Hello, everyone. I'm Dr. Rita Roy, CEO of the National Spine Health Foundation. Welcome to Spine Talks, where we bring unparalleled access to world-class experts like the doctors who are joining me today. I'm here at the North American Spine Society meeting in Los Angeles. Today happens to be World Osteoporosis Day, and we have bone health experts with us to talk about why bone health matters and what you need to know about taking care of your bones as it relates to your journey in spine health. So I'm going to turn the program over to our moderator, Dr. Tom Schuler, President of the National Spine Health Foundation. Tom?
Thank you, Rita. Well, this is so exciting to be talking on National Osteoporosis Day about something which is very important to all of us, is our spines, our skeleton. Because without it, we can't stand upright, we can't move. And without mobility, our quality of life drastically goes down. So I'm happy to be joined today by Dr. Venu Namani from Seattle. I'm going to have him introduce himself.
Hello, everyone. So I'm Dr. Venu Namani. I'm an orthopedic spine surgeon at Virginia Mason Medical Center in Seattle, Washington. I'm a spine surgeon with a particular focus on treating adult patients. About half of my practice is treating patients with complex spinal deformities that are often partially related to osteoporosis and bone health problems, as well as about half my practice that's related to treating all other spine problems, be it fractures or degenerative problems from arthritis and other things that can affect the spine.
Thank you, Vanu. So we're talking about Osteoporosis Day. What is osteoporosis and why do we care about it?
Sure. So osteoporosis is a disorder that's unfortunately becoming more and more prevalent in our population. And to speak of it simply, it's something that makes the spine and the rest of the skeleton more prone to fracture. And that can be a result of a decrease in bone mass as well as a decrease in bone quality that renders the spine and other bones more prone to fracture.
Okay, so I always use the example of a vertebra, which is one of the bones in the spine. We've got 33 of them that stack up to give us our entire spine. And those bones are a little bit like a piece of styrofoam. And the question is, how strong is that styrofoam? Is it a strong piece of styrofoam, or is it something fragile that you can easily push your thumb in? So when we talk about osteoporosis, there's a discussion of the inner part of the bone, the trabeculae. So what happens to the trabeculae, that inner bony lattice, with osteoporosis?
Yeah, so in osteoporosis, what happens with that trabecular bone is that it gets less voluminous. Basically, there's less of it to begin with, and it becomes thinner, and the architecture of that lattice also becomes disrupted. And all of this basically makes that bone more likely to crumble. I like to think of it almost as a Coke can, and someone who has weaker bone, that inner part of the bone can buckle or break.
And it's interesting that, you think of scaffolding. If you have a scaffold that's really strong, you can build it up multiple layers on the outside of a building to do work. But if it's weak, it's wobbly and they fall down. So that trabecular bone is like the lattice or scaffold that holds the bone up, which then keeps us upright. So when we talk about osteoporosis, what are several of the factors that make somebody predisposed to it? And we also can then talk a little bit about the age that it happens in.
Yeah, so there are a lot of different things that can cause osteoporosis. I think that one of the things that people commonly associate with osteoporosis is a lack of calcium and vitamin D and sunlight. And these are certainly all three of which are factors that can play a role in osteoporosis. But there are a lot of other things that people don't necessarily associate with poor bone health that are also factors. This is lack of weight-bearing exercise. This is smoking. This is excessive alcohol intake. A family history of osteoporosis or fractures can often play a role. And so sometimes you'll have patients that say, my mother had a hip fracture, my grandmother had a hip fracture, and these are also patients that are at risk. Then there are certain types of diseases that can also put you at risk for osteoporosis, things like rheumatoid arthritis, and some of the medicines used to treat those diseases, like chronic steroids, can also cause osteoporosis. There are even some other types of medications, such as medicines that people use for acid reflux, that also can result in poor bone health. And so these are all the things that can together play a role in weakening someone's bone health and making them further at risk for fracture.
We're talking about the word osteoporosis. Osteoporosis. It's a 6-syllable word. It's a huge word. And I think it's interesting to think about breaking that word down into the two components, osteo, which means bone, and porosis, which is like the word porous or poor. And so we're talking about poor bone, right? And I think if people can understand, that's what osteoporosis is looking at the condition of the bone. And I think there's a lot of confusion. It's such a big word. It's kind of a scary word. But we roll that word off our tongues so easily. But it is a tough word to learn. And just getting past that to understanding what causes it, why might I be more prone to it, are there things I can do to prevent it? Those are all conversations that we have to overcome just understanding the word, what the word means.
That's a great point. I just thinking of poor bone, when you hear it and simplifying the medical jargon makes it simple. And poor bone meaning it's just not as strong. And we need those strong bones to be able to stand upright, to move. And when you start fracturing things, that's a problem. So talking about fractures, what is the issue in regards to the spine and a fracture? What does that mean when somebody has a compression fracture in their spine?
So there are various ways that people can develop spine fractures, right? You think of if you're in a high-speed car accident, that's a violent injury that can cause the spine to break because the bone cannot withstand those forces. However, what happens in osteoporosis is that you can get fractures in the spine from doing something as simple as bending over to grab something out of a drawer, or turning around to reach something, or even sneezing. And basically, these are forces that should not cause the spine to break. And so anytime you break a bone, whether it's your spine, your wrist, or your hip, from an injury that should not cause the bone to break, by definition, that means you have osteoporosis or poor bone. The bone is not strong enough to withstand the normal forces that are applied to it.
And we call those fragility fractures, and it's a sign because it's fragile. So and it's abnormally fragile, and so when that's happening, it's a telltale sign that your bones are too soft. And so it should never be looked at as, as a fracture, it'll go away. The question is, why do you have a fracture? And if it was a major traumatic event, that may explain it, but then something needs to be done, because with a compression fracture, people have chronic pain, they lose mobility, and more importantly, the risk of other fractures because all their bones tend to be soft. So did you want to comment on that?
Yeah, I think that, osteoporosis is one of those silent disorders, and I think it's quite easy to understand that you have poor bone once you've already had a fracture. But the problem with osteoporosis is that you often don't know that you have it until you have suffered a fracture. And this is one of the reasons why we have such an epidemic of osteoporosis in this country, is because people's diets are changing, their exercise habits are changing, and because of this, we just see more and more patients with lower bone density. And when they come with a fracture, it's in a way too late. You really want to prevent these things before they happen. And so I think furthering the education of the public, getting people to really understand what they can do about their bone health to prevent fractures from happening in the first place is part of the mission of the National Spine Health Foundation.
That is so true. And preventing fractures is our goal. But unfortunately, there are times we see somebody who has a fracture, or that we need to do a significant spinal surgery on using modern instrumentation, meaning using metal, screws, rods, whether it's artificial discs or something to hold a construct. What is the impact of soft bones, poor bones, on our ability to realign the spine, maintain alignment of the spine, and what are the risks to the patients if their bone density isn't right?
So when we use these screws and rods and cages and other instruments to realign the spine, what we're doing is building a house, right? We are building an entirely new spine in some cases. If the materials that you have to work with are not strong to begin with, you can imagine that house is going to crumble. It's not going to be able to withstand the forces that are placed on it. And so people who have poor bone quality, who have especially some of these bigger spine surgeries, but even smaller spine surgeries, the screws cannot hold on to the bone. You can get fractures around where the screws are, where the screw meets the bone, or even in the bones above or below. And generally the outcomes are just not as good. And sometimes you then need further spine surgery to try to correct the problem. And sometimes this just perpetuates the problem instead of, if someone has osteoporosis and you identify it and it's a surgery that you don't need to do right away or emergently, the best thing to do is actually treat the bone first to then reduce the risk that that person has a complication. It's something that we would do if someone had diabetes or was smoking. These are known risk factors that can affect the outcome of spine surgery, but it's the same with osteoporosis. And so if we can treat the bone first to decrease the risk of complications, that's the better thing to do.
You know, Dr. Schuler, Dr. Namani, we're talking about patients that might have to have spine surgery and what to do about their bone health. We say in the National Spine Health Foundation that a healthy spine keeps you moving through life so you can live life on your own terms. And when it is decided that you need to have a surgical procedure to keep your spine in alignment or to alleviate pain or for whatever the cause might be, deformity, it's important to have your bones strong enough to withstand the surgery. And what I've heard the experts share with me is that increasingly they're seeing that patients come in ready to have a surgery, but their bones aren't strong enough to have the surgery. And I think for patients, it's really confusing. What do you do? How do you educate patients about what to do? And is there disappointment amongst those patients when they say, okay, I'm ready, I'm going to have the surgery, but oh wait, I have to wait how long now to get my surgery? And how am I going to tolerate the pain that I've had while I'm waiting for the surgery? What do we do? What do we say to patients in those conditions?
This is a very common thing that we deal with, because spinal conditions can be very, very debilitating. And so patients, as you said, can frequently come in to see us and they want their surgery now. I think it's our job to educate them that a surgery done rapidly, but without considering the factors that might affect the ultimate outcome of the operation, generally will lead to a worse outcome. And for the long term, their outcome is likely to be better if we correct those factors that can be corrected, with osteoporosis being one of them, before surgery so that they can have the best possible outcome.
I think that we have these building blocks of the spine, the vertebrae, and when we're doing a lot of the salvage surgery, reconstructive surgery, we're grabbing onto the spine with the screws and the instruments. And if that bone is not strong enough to hold that instrumentation, it's just kind of like putting a screw into weak, wet drywall.
Yeah.
And the screw will just pull right out. Well, the same thing can happen with the bone. And so we need that bone to be strong enough. So what are some of the things we can do to help a patient strengthen their bone in anticipation for surgery? We'll go back and talk about what they should do to avoid the osteoporosis. But let's talk right now about what can somebody do if they have osteoporosis or soft bone. What can they do to get their bone stronger before they have a surgery?
So the first thing is a proper evaluation to try to determine why they have weak bone in the first place. And there are lots of different reasons why people can have weak bone. We've touched on some of these things before. But if there's a medication that they're on that we know weakens their bone, try to get them to a different agent that's not going to do that. If they're smoking, certainly have them stop smoking. If they have a nutritional deficiency or something else going on with them medically, to treat that. Now, a lot of patients don't have any real identifiable factor, and they just have what's called primary osteoporosis. And in those situations, we want to optimize the things that we know improves bone density, getting them more active, in any way possible, preferably with weight-bearing exercise, making sure they have enough calcium and vitamin D in their diet. But if they have an actual diagnosis of osteoporosis already, that should be treated with one of the medicines that we know actually treats poor bone density. And there's a variety of different medications, all of which have different risks and benefits. And it's something that you should talk with your primary care doctor or your spine doctor about to see which might be best for you.
That's great. I think today we're blessed to be living in this biocentury with these incredibly powerful medications that can reverse the soft bone. The more traditional ones that we've used just kind of slow the rate of loss and hope that it gets relatively stronger but a little more brittle. And now we have medications that can actually reverse that process and make the bone stronger, or in some cases make it stronger while reducing the resorption, and we end up with a better product, a better bone, a stronger bone. So powerful drugs are available today that we didn't used to have that are game changers.
Yeah. One of I think the paradoxes, or a paradox for patients, is that we know that movement helps strengthen bones, and we know that movement helps keep you in motion, but when you're in pain, you're less likely to move. So it's a little bit of a domino effect, right, for those patients. I think that can be a challenge in encouraging patients to keep moving when they're in pain. What do we advise to patients in that situation?
It absolutely is a challenging thing. And what I tell people is to find something that they can do to keep moving. If they say they can't walk, I tell them to get on a stationary bike. If they can't get on a stationary bike, I tell them to get in a pool and do some water walking. But something that they can do, and almost every single person can find one type of activity that does at least allow them to move. And movement, although people begin to fear movement because it causes pain, part of it is actually breaking that connection of movement with the fear of pain. And once you get them into a type of activity that they can do that doesn't create that pain, and then becomes a positive feedback cycle, they begin to move more, and it helps all aspects of their health.
And that's so important because, Dr. Schuler, as you talk about this great age of bioscience where there are incredible medications that can help build bone, a lot of times patients who are in that time period of waiting for their surgery while their bone is building, staying active. So it's overcoming the fear of the pain, staying active so that they can decrease the pain and build their bone. And it's a very exciting time because the medications work and you see those incredible results. So talk to us about what happens when patients come back with stronger bone.
Motion is life. And staying moving is critical, and that's what we're trying to do. If we can avoid the fractures, that's the best thing because we don't get into that pain cycle. And it's just the death rate or mortality rate is very high in people that have a fracture and they're in pain and they don't get treated. And I think it's this trickle-down effect of, okay, I'm not moving, I'm hurting, therefore I'm gaining weight, or my heart's having problems, and it becomes this downhill roll where ultimately it ends up in somebody's demise. And so this is something that we're trying to avoid. But are you finding that the patients that you've treated before surgery, then go do surgery, they're able to have a successful operation as a result of that?
Yeah, it's often like night and day, especially occasionally we have to treat patients in an urgent fashion for some urgent problem. And sometimes those patients have osteoporosis, but you have to treat the urgent problem. But then once you fix that, if they have some sort of complication, you can treat them later. And then you essentially have a before and after, feel of their bone during surgery. And it actually is quite dramatic, especially with some of these bone building agents like you're talking on. It feels like totally different bone, And so the medicines do work, and they can have a tremendous impact on bone density. And really the main thing to remember is this doesn't just affect the outcomes on their spine. It reduces their risk of a hip fracture. It reduces the risk of a wrist fracture, a shoulder fracture, all of these things that can affect mobility and pain and function. And that's why treating these things is so important.
I mean, it used to be if somebody had a hip fracture, they had an 80% chance of being dead within a year, because it was already towards the end of life, soft bones are not moving, and then that just makes them so immobile. In the spine, some of the fractures are minor, but they hurt, and it's a sign they're at risk for more fractures, and sometimes they can be debilitating. And so I think it's just so important for the public to understand you need to be asking your providers, whether it's your family doctor, whether it's your spine specialist, whether it's your orthopedic surgeon, whoever you're seeing, your pain management doctor, that how can I be tested to make sure I don't have bones that are too soft that I can get into trouble, even if it may not be the cause of your pain at that time, but you want to avoid that problem. So something that we as spine specialists do all the time is try to treat people in pain. So what about steroid injections, something that get ordered fairly frequently? Do they create a risk for osteoporosis?
So it's a great question, and there is certainly very good data that chronic oral steroid use in the form of pills does increase the risk of osteoporosis, and there is some data as well that suggests that frequent steroid injections taken over many years that some of that does get absorbed systemically and can also increase the risk of osteoporosis. We think it's likely less than chronic oral steroids, but all of these treatments have potential side effects, right? And we have to consider that in terms of the long-term health of a patient. And so it's something that we do keep in the back of our mind as we counsel a patient going forward on how best to treat that pain.
Yeah. So just getting a steroid injection repetitively may be dangerous to your bone health, to your overall health, and isn't necessarily a good answer.
Yeah.
So, stay on top of that and understanding the bone density, I think is important. So saying bone density, what is bone density? How do you measure it? How do we track this?
Yeah, so the most common test that we order, or your primary care doctor may order to check bone density, is something called a DEXA scan. And a DEXA scan basically measures the density of bone. It's typically taken at a site in your hip and a site in your spine and occasionally a site in your wrist. And basically it allows a comparison to younger adults in terms of how dense the bone is. And based on the scoring system that comes back, you can then assess whether someone has normal bone, osteopenia, or osteoporosis. And it's measured in something called a T-score, which you might see in a report. And a T-score that is less than minus 2.5 is equivalent to having basically diagnosed as osteoporosis. Osteopenia is a lesser amount, which is a T-score between minus 1 and minus 2.5. And that means that you have osteopenia or soft bone. The one thing that I would say in terms of a misconception, I think, that some patients and even some primary care providers have with how to interpret these is that we'll commonly see patients that come in to the office with a vertebral compression fracture and they say, well, I don't have osteoporosis, I just have osteopenia. My T-score is minus 1.2. But the reality is that once someone has a fragility fracture, like you mentioned, whether that's the spine, the hip, the wrist, the shoulder, by definition, that person has osteoporosis and needs to be treated.
Dr. Namani, can you say that again? Because that's huge, and I think there's so much confusion about that. Let's say that again.
So once you have a fragility fracture, if you have a fracture of your spine, compression fracture, burst fracture, or you've had a wrist fracture from a ground level fall from some type of mechanism that should not cause the bone to break, by definition, you have osteoporosis that needs to be treated.
No matter what that T-score is, no matter what I think that's just really, really important for people to hear, because that is a warning sign of things to come, right, in your body, and treatment needs to happen.
Yeah, that's the big concern is, are we setting ourselves up for failure because we're in a dangerous position with our bone strength that other problems are going to happen? And that's it. We can't put our head in the ground in the sand and hide and say, oh, it'll go away.
Yeah.
It's we need to act, not after we have another fracture.
Right.
I think this is also a really important thing, is that physicians are very busy, and most orthopedic surgeons, neurosurgeons, spine surgeons aren't spending a lot of time managing the bone strength, which is an important part about the spinal health and the bone health. And so it's important that as patients, you're demanding that gets done, and you have communications with your family doctor, with your specialists, so that we can make sure that you're protected and raising the awareness. And it's reality of medicine is people are very busy, and they sometimes don't get outside what they consider their area of expertise. But because we deal with the bones all the time, it's essential that we walk in this world and partner with you to make sure that your bone health is good.
Yeah, absolutely, 100%.
And do you spine specialists treat osteoporosis? What is the state of that? So if you're a patient and you go to see a spine doctor and they tell you have osteoporosis, then what do you do?
So there are many different types of doctors that treat osteoporosis. I think that the majority of osteoporosis treatment happens by primary care providers. There are other specialists that are thought to be osteoporosis experts, and these are often endocrinologists, rheumatologists, physiatrists can also be experts in osteoporosis treatment. And there are some spine surgeons that have taken an interest in doing this and try to work closely with and partner with these other specialists to try to treat bone health. You ultimately want your surgeon spending time in the operating room fixing the things that he or she is trained to do best. But it's certainly, I feel very strongly that, as Dr. Schuler said, that we need to take a very strong ownership and interest in this, because our patients come to us with pain and they have problems that rely on their bones being strong for us to fix appropriately and with the lowest risk. And so if we are not good stewards of this and help them navigate that process, then we're doing a disservice to our patients.
So let's talk a little bit about what we can do to avoid this problem. So we're talking about when you get diagnosed with osteoporosis, or you have bones that are soft that need to be treated, what can people do to try to avoid that or prevent that from happening?
So the main thing is, like we talked about earlier, being active. I think being active and getting regular weight-bearing exercise is probably the number one thing that people can do to try to prevent osteoporosis. The other things they can do is try to avoid those activities and habits that are known to decrease bone health. So these are things like smoking, excessive alcohol use. If people are on medications that are known to affect their bone health, such as chronic steroids or certain types of reflux medications that can affect bone health, and those can either be changed or avoided reasonably with the patient's other problems, then that's something that can be done as well with their primary care provider. But the main thing, I think, is movement. People need to just get exercise in any way, shape, or form possible.
And Dr. Namani, should people take calcium supplements?
So it's an area of ongoing research and debate. There were some recent studies that suggested that excessive calcium could be associated with heart issues. That data has not really been borne out, to my understanding. It's generally thought to be fairly low risk to make sure that you're getting enough calcium and vitamin D, and the vitamin D3 especially is important in the diet. And so I do generally recommend for my patients to take a calcium and vitamin D supplement, at least 1,500 milligrams of calcium and 800 international units of vitamin D per day, to make sure they have enough of that in their system.
Yeah, that's
the reality on the calcium supplements is, if your body can't use it, it usually doesn't absorb it. So it would pass through. And the best source of calcium is going to be in natural foods as opposed to supplements.
That's right.
So eating a diet rich in leafy green vegetables, some dairy products, things like that. And there's many out there which you can find on our website,
right.
spinehealth.org.
Yes. And I had another question, Dr. Namani, in terms of strengthening bones to prevent fractures or to prevent osteoporosis, if you can. You talk about weight-bearing exercise. Can you talk to us a little bit about what is weight-bearing exercise? What are some of the weight-bearing exercises, and why does that matter to your bones? How does that
Sure.
work?
So people sometimes think of bone as wood or concrete, but bone is actually a living, breathing structure that changes in response to the weight and forces that are put on it. And that is actually responsible for the way the bones are shaped, where they're strong in some places and weak in other areas. And so weight-bearing exercise basically means any type of exercise where gravity is acting on you. So the classic non-weight-bearing exercise is swimming. Swimming is a great full-body exercise. It builds the cardiovascular system and strengthens your arms and legs, but it's not a typical weight-bearing exercise. So in that sense, not necessarily good for your bones, as it doesn't load your bones, but things like walking, hiking, jogging are all weight-bearing exercise. Also.
Shopping?
And shopping, yep, exactly.
Especially the more bags you have.
Yeah, the more bags you have, it's better for your bones,
Yes,
right?
yeah. Load up a backpack, go to Costco and carry everything on your back. So,
And then you see the back doctor.
Yeah, but I think that even if someone asks me, look, the only type of exercise I can do is swimming, and they say, but that's not weight bearing, is that okay? Yes, it's okay.
Yeah.
It is a type of movement and it's a type of exercise that is going to be better for you than doing no activity at all.
And I think swimming, since I'm a swimmer, I think swimming is probably the best exercise for the spine from a flexibility, conditioning. It's great for the heart, great for the lungs. But I think the message is, don't just do that. and mix it and do other things. So even though one exercise may not be the best weight-bearing exercise, it doesn't mean it's not important for your spine health, your overall health. And so I think the biggest thing is variety. Don't do the same thing all the time. Mix up what you're doing, but you should be doing something every day, 7 days a week.
It's just really remarkable how just walking can be not just good for your bones, good for your heart, good for your
mind.
Just that movement. And so staying in motion is such an important component to, you say overall health, your whole body. So that's why it's so important that when there is a spine problem, that we can fix that for people and get them in motion.
Absolutely.
Yeah.
So an important concept is using medicine to build your bone back. If you've lost bone and you want to get it strong again, or your surgeon wants you to get it strong again, hopefully it's a team effort. But what about taking medications? How long do you have to treat for? And what impact does that have? And is it something people should be afraid of?
Yeah, that's a great question. And so many times I hear from patients that they were recommended to take a medicine for osteoporosis years ago, but they were so afraid to take it because their dentist told them not to take the medication because they told them that their jaw was going to fall apart, or that they were going to be at risk for having new fractures because of the medications. And the reality is that while medications can have very, very rare side effects, these types of medications prevent so many fractures, and the benefits of these medications far outweigh the risks of the medications. And each medication has a different type of risk profile. If we think about the groups of medications broadly that treat osteoporosis, there are medications that stop bone loss, and then there are medications that build more bone. And there are really 3 different types of medications that are fairly new but have really great data behind them that actually build bone and decrease the risk of both hip fractures and spine fractures.
Now, so it's important to know that just because you heard something years ago doesn't mean it's true today. And like all areas of life, the technology keeps evolving. And with these technological innovations, we have better ways of treating problems that maybe even 5 years ago, 10 years ago, we didn't have the options we have today. So it's important to get the most current treatment, the best understanding of how to manage your problem, and don't be afraid. Let's talk a little bit about the longevity. Is treating it for a week, a month, a year, or a lifetime?
Yeah, so it really is a case-by-case basis. I don't think there would be anyone that would be treated for a week, and usually it's not a lifetime either. But usually people are on some type of medication treatment for years, and it depends on what medicine you are on, how long that medicine can actually be taken for safely. Sometimes you end up switching medicines over a period of time, especially with these bone-building medications. They're often taken for 1 to 2 years, and then you're switched to one of these medicines that are of a class called bisphosphonates that basically seal in those gains that you made from building bone. And so it's really important to work with your primary care provider or your endocrinologist or your spine doctor who is overseeing your osteoporosis treatment to figure out a timeline for you that's specific to you on how long you need to be on these medications.
I think that's the important message, is that the medicines would evolve, and you most likely will not be on the same medicine throughout the duration of treatment. And it's important to understand that different medicines treat different parts of the process of the bone health, the bone life, and the bone metabolism. Well, this has been a fun, educating day on Osteoporosis Day, and I'd just like to close with my little word of advice to the public is take the time to get your bones strong when you're young, because you can only build your bones up till about the age of 30. And it's that bone bank that you build which is going to be with you the rest of your life. So when you're young, eat the right foods, do the right exercise, get the bone strong. Then beyond that, it's important that you maintain appropriate calcium in your diet and vitamin D in your diet to slow the rate of withdrawal that happens for the rest of your life, and to try to avoid things that aggravate it, whether it's smoking, vaping. All these things are destructive to the bone, excessive alcohol, poor nutrition. All those things can significantly impact your bone. Get your conditioning in, And then on top of that, if you do have health issues, such as diabetes, renal disease, liver disease, you need to be on top of your bone health even more to protect yourself.
Yeah, thanks so much. I think this has been a really great discussion that we've had here today, and I would echo that. I always tell patients that you only have one body to live in for the rest of your life, and to take care of it as much as you can, do everything you can while you're young, if you're still young, to keep yourself healthy. As you get older, inevitably health problems are going to creep up, but especially as it relates to your bone health, you often won't know that your bone is having problems until it's too late, until you've broken the bone. So make sure you get the normal health screening that you should get with your primary care provider to make sure that your bone health is where it should be. And if it's not, make sure you act on it sooner rather than later to prevent developing new fractures that can cause pain, loss of movement, loss of function.
Well, I'd like to close by thanking the experts who joined us today. It's remarkable that I have on the panel with me spine experts, back doctors, back and neck doctors, and we're talking about bone health. And the reason for that is that your spine is a series of bones, and that series of bones works together to keep your body in alignment and to keep your body moving. So if we don't take care of the bones, we can't take care of anything else with that spine. And so I just want to thank these experts who are so dedicated to their patient outcomes. They want to get the best outcomes for their spine patients, and they know that in order to do that, they've got to take care of the bone health, which is a total body problem. And so I thank our healthcare heroes. They put the best of science into practice every day for their patients, and they're taking the time out of their busy schedules to sit down with me, to sit down with the National Spine Health Foundation, and to share that information for your benefit. So I thank you for being with us.
Thank you.
Thank you.